The All Sooke Days podcast. It's about Sooke businesses, Sooke people, and Sooke history. Brought to you by SookeMortages.ca. With better rates and service, come see why we are Sooke's first choice for mortgages.
Well, welcome to the All Sooke Days podcast, everybody. I'm your host, Daniel Baker. Today, the All Sooke Days podcast is brought to you by SookeMortages.ca. With better rates and service, come see why they are Sooke's first choice for mortgages. Also by Sooke Oceanside Brewery. Come visit their new waterfront tap room and patio for a pint. And Pizzability, when only the best will do. And, of course, Meanwhile in Sooke, Sooke's largest online community. Today with me, I have Rick Robinson.
Thank you. Pleasure being here.
Thanks for coming, Rick. How's it going?
Today is a great day.
Awesome. Well, let's kick things off by asking, how did you start your day today? You woke up, you had coffee, then what happened?
Went over my notes for this interview and braved the Sooke coming in.
Yep.
The drive was good. Not too much rain this morning, so.
Yeah, we're supposed to get another atmospheric river today.
There's another river coming.
Yes.
But Sooke has done quite well with not too much flooding, so we're blessed.
Yes, we definitely have
lucky.
fared a little better, and all our thoughts and prayers go to everybody else that's
absolutely
been affected.
Many parts of the province are just inundated, and it's very sad for what's happened.
Definitely. So, Rick, you're part of the Sooke region community. Oh, don't let me mess this up.
Want some help?
Yes, please.
I'm the vice president for the
Sooke
Region Communities Health Network.
Right. So you guys are advocating for a new senior center in Sooke.
So one of the things we do, yes, absolutely.
Right.
There's a need for an elders center. That's what we're calling it. We kind of dropped the term seniors because that's hard to define.
Right.
I think elders is more politically correct these days. So, yeah, it's an elders drop-in center and 79 affordable units for rental housing.
Oh, wow. That's awesome. And we were just talking about it a bit off the air here, and you were saying it actually didn't get approved in the end. I thought it was already slated and going through. What happened?
No, unfortunately, we didn't make the cut on this go-around. Our primary funder target is BC Housing.
Right.
That would make it a lot easier to proceed with rent-assisted housing for us, although we are exploring other options now as well. But that was, we understood, we scored very high in our application. There was no problem with our application whatsoever, but it was a geographic decision. There's so many needs in the province and other communities, and some housing was coming into Sooke, and so we didn't make the cut this time, and that's the rationale, although there was good support and excellent feedback from BC Housing, so we'll be reapplying when the next funding call comes, and we're anticipating that's going to be in the next approximately 12 to 18 months.
Oh, nice. Well, that'd be good.
Yeah.
And so you said that's not all you guys do, hey? There's many other things. Like, what else does your organization do?
Well, we actually started as something called CASA, which was an association of community service agencies in Sooke, and at that time, in 2003, we helped to build a Child, Youth, and Family Center in Sooke. That was the prime reason for that cooperative coming together.
That's an amazing center, by the way.
It is.
Me with two little boys, we take them there all the time for all different sorts of needs, like their shots and stuff, and also I remember my youngest, I was taking him there for little music lessons and stuff too, and it's just an amazing center. It's so awesome that something like that is in Sooke.
Oh, absolutely.
So thank you for making that happen.
Wasn't me personally, because I wasn't a member of
Right.
the network at that time.
Right. But
then there was another organization called the Community Health Initiative that was interested in doing health research, finding out what the needs for services were, what the service gaps were in Sooke. And I have been a member of that organization when it was around since about 2014, I think, was when I joined them. And shortly after, we amalgamated the two organizations because there really wasn't a need for CASA to be around any longer, as the building was built. They weren't managing the building. So,
right.
But there was still a good charitable nonprofit cooperative structure available to us. And actually, I was president at that time, and we amalgamated the two organizations and became Sooke Region Communities Health Network,
Right.
part of a number of health networks on Vancouver Island. I believe if I'm not mistaken, I think we were the first, actually.
Okay.
So from then on, we've been concentrating on addressing what services were needed in Sooke, trying to make it evidence-based in terms of where we were going to spend our efforts. It's an all-volunteer board, and we've very small organization. We've recently morphed from a part-time coordinator, a paid position for one individual,
Oh, wow.
to an executive director, still part-time, and then a couple of part-time paid individuals. So over the years, we've done a number of things. So we spun off the food initiative in Sooke. That was part of our organization, and we're kind of an umbrella organization that helps other organizations come along, and we're not interested in running everything to do with health in Sooke. We spin it off usually
Right.
when that organization has enough horsepower to manage on their own.
So you guys basically present the needs that are needed in the Sooke community, essentially.
We listen to the communities. That our name is plural. It's communities. So
Right.
our service area, the area that we're interested in and making some changes and creating healthy communities, goes from Beecher Bay to Port Renfrew.
Oh, wow.
So it's quite a large area.
Yeah.
But primarily our services are based in Sooke and out of Sooke. So currently we have a number of projects on the go. We are funded by the United Way to provide the Better at Home program. COVID, of course, has overlaid a lot of what we're doing. So
Right.
we've changed how we deliver some services. The Better at Home program is one of them. Because of COVID, we haven't been doing home visits, but we do provide housekeeping services, yard work, grocery shopping,
Oh, wow.
prescription pickup. I think the last time I saw the number was around 70 seniors in this general Sooke area. So that's been ongoing. We do, because we're not doing home visits, or we haven't been, we do just wellness checks. We have a lot of isolated seniors in Sooke, about something like 13% of the population of 15,500, where Sooke is right now, are over the age of 65, and many of them are isolated seniors living by themselves. So having that social contact is really important.
So how do those health checks happen if you can't go visit? Like you just call and say, "Hey, how you doing?"
Pretty much. We have a wonderful group of volunteers that volunteer with us that go through the usual criminal record checks, et cetera, and with some orientation. They're the ones that usually make the calls.
Right.
So it's that's one area of focus has been seniors. The other area of focus was we spent a lot of effort in terms of trying to address homelessness in Sooke.
Right.
So we actually ran the two homeless shelters, Sea Park and then the one on Otter Point Road,
Oh my goodness.
for almost a year, I guess, in total, pretty much. We went from having a part-time employee, the coordinator, to approximately 25 staff overnight.
Wow.
So you can imagine what that entailed for a volunteer organization, all of the policies that had to be written,
I can only
including
imagine.
payroll, et cetera, et cetera. So
My goodness.
that was a big challenge,
Right,
and
yeah.
with a tough nut to crack as well. And I've got to say, Mayor and Council were extremely supportive, as was BC Housing, which is the prime funder for those COVID emergency shelters for the homeless in Sooke.
What was one of the biggest challenges running those two homeless shelters?
The first one I think was a little bit easier because we moved into the arena at Sea Park.
Right.
So there already was a space that we didn't have to do much with except install a washer dryer.
Right.
And some minor structural things, and allowed people to camp in their tents on the ice rink. Obviously no ice, but
Yeah.
in that space. And so that was reasonably easy. And it was a matter of cobbling together the services, because it's not just food and lodging that you're providing. It's also addictions and substance use counseling, social work counseling, getting paperwork done for benefits, etc. All of that was entailed. So, and we had excellent partners, as I mentioned, with BC Housing, District of Sooke, RCMP were very cooperative and helpful. And the Sooke Shelter Society was just excellent. They're the one with boots on the ground. They've been doing this since about 2018, I think, providing services for the homeless in Sooke, usually dispersed throughout the community and more rural areas outside of the district specifically. So we partnered with them, and they were providing services both within the shelter and, of course, still dealing with people that were living rough out in the bush around Sooke. So that morphed into, you may have heard about the Hope Center and what's happened. So working with the Sooke Shelter Society, we our board mentored their board to give them the skill sets and the experience that they needed to actually take on a permanent residence for homeless shelter with transitional housing as well.
Oh, wow.
So BC Housing actually purchased the Hope Center from the Macola Housing Society.
Oh, wow.
So Sooke Shelter is there now, running their programs with mental health and support and providing meals, and there's a homeless shelter there now. Then over time, I think there's approximately 33 units there, and as people that are long-term residents move out of that space, they're not necessarily homeless individuals, but low-income individuals, and other spaces being provided for them if they so wish to move by Macola Society.
So the 33 units, is that enough, or is that...
It doesn't address the total needs, but what it does provide is transitional housing, meaning with appropriate counseling and progress, individuals can start living semi-independently in the housing that's available, and they obtain more independence as they progress with they may have substance issues or mental health issues that need to be addressed, and so as they become more healthy, I think would be a fair term, they move into that accommodation.
Right.
And the goal, of course, is to get them back into just society in general. We actually have placed, prior to the Hope Center starting, we placed a couple of individuals in positions that they could actually work and live independently. So
that's
the
awesome.
need is there, the support is what's needed, right?
Right.
So that's one thing that we've done. But we do a lot of other things besides Better at Home, and we're helping with the homeless situation. We've provided music therapy for patients with dementia, seniors nutritious cooking classes. We're pretty diverse. Falls prevention. And of course, we run the Sooke Region Volunteer Center, and there's a website associated with that lists all of the services that are available in Sooke.
That's awesome.
We spun off something called Lifelong Learning.
Lifelong Learning, what's that?
So that's a group that works with us, and they provide, pre-COVID, they were providing in-person educational experiences, broad sense topics, everything from physics for people that didn't know anything about physics, to current political news, to history topics, to you name it, they've probably covered it. So that's ongoing now, even with COVID, it's virtual. And my understanding is they've spread beyond Sooke and the region, so they actually have individuals that are dialing in from, still within province, but from other communities that don't have a lifelong learning. It's targeted for elders, but pretty much anybody can go and participate in those educational experiences.
That's awesome.
We also do income tax preparation in the taxation year for low-income individuals that require help to file their income taxes. So we do that as well. We've been doing that for, I think, 4 years now.
So you guys provide a lot of support in the community then.
We're very diverse, and just to stress, like all of these services, pretty much, with some exceptions, are delivered by volunteers.
Right.
Housekeeping services for Better at Home and yard work, those are paid part-time positions. But everything else is volunteers. Sooke is an amazing community in terms of how they step up
That's true.
when there's a need. The other thing we're involved in is primary health care.
Right.
Getting a GP or a nurse practitioner is a huge need in West Shore and Sooke. So it's been one of our key concerns in terms of addressing the health needs in Sooke and for the region for that matter. So we sit on what used to be just the Mayor's Committee. Now it is a joint committee by Island Health and the Mayor. Shared jointly, and this brings service providers together to look at how we can improve primary healthcare services, access to services in Sooke primarily. And
So would that include, like, because I know there a lot of people were talking about at one time proposing a hospital in Sooke. Is that a need? I guess you guys would be researching that. Is that
Sure. We've done a bit of research in collaboration with the South Island Division of Family Practice. I sit on one of their committees as well, representing the Sooke Region Communities Health Network. So we were in partnership with West Shore Family Medical Clinic and Island Health and the District of Sooke. We helped expand that clinic in terms of basically, our role was to specify the need and certainly support the clinic in their need for expansion. That's a great clinic. It's integrated health with social work and nursing, and there's some counseling services available, as well as family physicians and a nurse practitioner. But that's the big but.
Yeah.
So there's still about 3,200, I think, at last count that I'm aware of, unattached patients in Sooke. So those are folks without a family physician. They rely on walk-in services somewhere. In Sooke or West Shore.
That's a big number.
It's smaller than what it was before the Sooke clinic expanded, and we're able to take in a nurse practitioner and one or two additional physicians, but there's still an unmet need. So you couple that with the expected population increase in Sooke. So as I mentioned previously, we're at about 15,500, I think. And
that sounds accurate, because in 2016, I thought that was the last census, and they said we were at like 13,000.
And one.
Yeah.
13,001. They were very exact. But best guess is about 15,500. And by 2030, the expected population in Sooke is going to jump to 25,000.
What?
Yes, 25,000.
25 by 2030?
Yes.
Oh my goodness.
That's what the District of Sooke is focusing on now in terms of the extra housing.
So this is why I
So there's a need for more primary health care services.
Right.
The clinic is, they've expanded as much as they can in their current location in the Western Foods Mall.
Unless they started building up, but I don't know how they'd be able to do that.
It would be very expensive and somewhat limited in terms of what we could provide. So the vision that we have, and it's also shared with Mayor Tate as well, and that's the formation of, we haven't come up with a definitive name now. The working names were Regional Health Center or Primary Care Facility. It would not involve overnight beds. It would be very hard to justify a hospital when we can access a hospital that's 30 to 40 minutes away, VGH. Very difficult and very expensive for the taxpayer as well. But what we do need is one-stop shopping in Sooke, and that's expansion for more primary healthcare providers and the whole integrated team, probably expanded, and having diagnostic imaging in the same location, state-of-the-art diagnostic imaging, which we really don't have now. It's better than it was, but it's still not state-of-the-art. and also medical laboratory services, all in the same building for the community, just
Right.
ease of access. Like the Elders Center, there is property available. For the Elders Center, we have a memorandum of understanding with the District of Sooke for 100 years,
Oh, wow.
for a little more than an acre in the northwest quadrant of the 5 acres on Wadham's Way.
Oh, okay.
And then there's another quadrant, the new library is going in sort of across the driveway from us.
Right.
And then there is space on that southwest corner for this medical center. Probably what I think is going to happen, and I'm just speaking for myself at this point, not the District of Sooke, but probably what we would call a community health center. The province, the Ministry of Health, has funded a few of these CHCs.
Okay.
The newest one is opening up in the spring in Colwood at Pacific Center. Target population, low income, people with mental health and substance use issues. We would have a slightly different target. It would be the general population, right? Just an expanded medical clinic with other services that are integral in that expansion. So the property, when we did what's called the charrette in Sooke, when the community came together working with the District of Sooke and experts in community development, we targeted that little more than an acre in that southwest corner for a medical center and probably more affordable housing as well. So that's the vision. The CHC is run by a nonprofit board. It's a little different than what's there at the clinic right now. They're fee for service, and for physicians coming on board, the expectations would be they would be under contract with us.
I see.
Relieving them of all of that administrative stuff that physicians don't particularly like. They're not especially trained for it, and it just relieves that burden and provides other benefits to them, like there's vacation, there's educational leave, that type of thing. So
Oh, well, that'd be good.
it's a more appropriate, I think, experience for physicians, particularly new physicians that are used to training when they do their residency at the community level. The feedback we've had is that they really like working in that integrated practice. Again, where there's social work and mental health and addictions counseling and nursing support and colleagues that work as a team. And Sooke is already doing that in the West Coast Family Medical Center.
Oh, they're doing a great job down there.
They're awesome,
Yeah.
and we really enjoy working with the physicians there.
It's crazy for me, like growing up, going there as a kid and remembering it was just a tiny little office, and now what's expanded. It's like, oh, okay, I can get lost in there if I take the wrong corner, So
well, exactly. The renovations really changed, and
Yeah.
with the expansion, it's not the clinic that I recognized anymore.
No, but it looks really nice in there, and it's really clean and professional, and I think it's a great thing for Sooke, and we definitely need another one in Sooke for sure. Some sort of medical center to.
Yes,
help
we do now need, right now, more primary healthcare services in Sooke, and not just primary healthcare. We really need more mental health services and substance use counseling.
For sure.
Because that's an identified need. We're actually doing a survey right now on the mental health needs, working with all of the providers that provide mental health services and substance use counseling in West Shore and Sooke to find out, again, where the gaps are. We're trying to make evidence-based decisions, and so that there's also a partnership with UBC. We're going to be doing something called community mapping for adult mental health services. So we bring a team in, we work with existing individuals that are providing services to identify, well, first of all, what's here,
Right.
What are the wait lists like, what services are being provided, and where are the gaps in this.
Right.
So anyone that we've talked to, there's wait lists, right?
Yeah.
So imagine yourself, single mom, you don't have a physician in Sooke, and you've got kids. So, and you can't afford a car, so what do? You wait for a bus. And although the bus service has improved, to get to the West Shore with your kids, get the services that you need, and then get back to Sooke, that's at least half a day, if not a whole day.
Oh yeah, no, it's we need a rail line. Anyways, yeah, no, it's ridiculous. So that's why we got to build more of these services in Sooke, and that's I guess so that new expansion that's going to be happening. Where is it by the post office there? Is that a spot that might get a center as well, or is that just going to be all retail, you think?
I don't know very much about that, but there
Okay.
hasn't been a discussion around medical services being focused there. I haven't heard that.
Oh, okay.
Don't know.
Well, maybe they should look into it.
So the time frame for the community health center in Sooke, that's really, I think optimistically, it would be 5 years in the planning,
Oh, wow. That's actually a lot sooner than I thought it'd be.
getting the funding lined up and the Ministry of Health on board and Island Health, et cetera, et cetera.
Right.
It's all about partnerships, and that's how we do business, and that's how the medical clinic was expanded in Sooke for phase 1 expansion.
Right.
And then probably 18 months, 2 years in the build. So we're at least 7 years out, if not longer. I'm being very optimistic when I say 7 years and we'd open the door
Yeah.
to a community health center. But it's needed now,
Definitely.
and it'll be more needed, absolutely critical in 7 years' time.
Yeah, that's the thing with Sooke. It feels like we can't keep up with the demand with a lot of things.
Exactly.
Not just with the medical services, but also the housing as well.
Yeah, and I'll just say just a bit more about the Elder Center. So this is a combination of an Elders Drop-In Center. Sooke hasn't had a senior center for more than, I think it's 12 years now. So the seniors have nowhere to go. Like most other communities in the province have a senior center. We don't.
Yeah.
So the vision was, well, why don't we build an Elders Drop-In Center and then couple on affordable housing. So we're looking at 79 units of affordable housing, subsidized, hopefully by BC Housing or some other funding agency, with an integrated elder center. So the services that we're currently providing, the Better at Home services, would be located in that building in the Elders Drop-In Center. And for those residents that needed it, we would provide services. So it's not assisted living, still very independent living, but there's a place to come and socialize, get a meal, meet your neighbors, and have some activities, educational sessions, activity, exercise, that kind of thing. The goal is to enable people to live independently in their home longer. We also have good support from the Sooke Nation as well. Chief and council are very supportive of this because there is a significant number of Indigenous individuals that are living off reserve.
Oh.
So this would be a collaborative experience as well, with a focus on First Nations, trying to not be all thanks to all people, but certainly recognize Sooke's heritage, particularly with the Sooke Nation.
Definitely.
The other spin is this is going to be a co-housing model.
Right.
So this would be one of the first rental co-housing models in Canada. There's, I think, one or perhaps two, and so we would be amongst the early co-housing models in a rental situation. So what that means is, and I actually live in a co-housing, the second one in Sooke, West Wind Harbour co-housing.
Where is this, sorry?
Right in Sooke on the waterfront. It's a West Wind Harbour co-housing.
Oh, West Wind, okay.
Harbourside was the first co-housing model,
Right.
multifamily, and we're the second. But using that kind of a model so that you're not just renting an apartment, you're living in community. You have a say over how things are run in your building. It's more than just if they were to own it, it would be something like a strata council, but only more in terms of the sense of community that we're trying to build. We think, we're pretty sure we can keep people out of institutional care longer. There's not enough research to prove that, but common sense would indicate if you're well supported emotionally and you're eating nutritious meals and you have companionship, friendship, you're going to do better on average.
Yeah, if the physical health and the mental health are good, everything should be
Right.
good, you think, right?
So the other partnership, and we do a lot of partnerships, I could go on, but we're partnering with UVic, this
awesome.
center, I think it's called the Center on Aging and Lifelong Health, or title, something like that, and to do some research. So to look at a cohort of elders that aren't living in a co-housing experience, and then looking at the cohort that would be in co-housing, just to see the differences in quality of life, the access to medical services, if there's a drop in the need for that, even things like less medication in some cases.
Yeah.
Seniors often are, unfortunately, are subject to polypharmacy, meaning there's a lot of medications happening. Fortunately, Sooke Clinic is pretty good in terms of looking at the overall prescription use and making sure there aren't any problems, but typically seniors are on a lot of meds. So there's some research opportunity there. Can we reduce that in some way?
Definitely.
And it's about quality of life. Are you happier now than when you were living independently on your own? So those are questions that need to be answered. There needs to be research, definitive, both qualitative and quantitative research.
Wow. Rick, you guys have been busy, it sounds like.
Well, we have just an amazing board. Our president is an amazing woman, Mary Dunn. She unfortunately could not be here today. Mary's running an immunization clinic in Sooke. She's a retired, quotes, retired. Now she's come back into active service, public health nurse.
Right.
And she has a long history living in the Sooke region. And we just have some excellent volunteers who really want to make a difference in not only Sooke, but in the region.
Well, that's awesome, Rick. It looks like we're running out of time here, but I mean, is there anything you'd like to say to the people of Sooke, or any shout outs you'd like to say? Or
No, go to our website, and if you feel like donating to a charity, then we would gratefully accept the funding from folks in Sooke or the region. The website, it's Sooke Region, CHN.org.
Well, thanks again for coming on, Rick.
Yeah,
I really
thank you very much.
appreciate
It was my pleasure.
All right. We'll talk soon.
All right.
The All Sooke Days podcast. It's about Sooke businesses, Sooke people, and Sooke history. Brought to you by SookeMortages.ca. With better rates and service, come see why we are Sooke's first choice for mortgages.